Hello, everyone. We're going to be getting started here soon, just as soon as everybody joins. Thanks you for joining. Hey, Dr. Harris.
Hey, what's going on?
Not too much. Looks like we got people joining in now. We're going to
Perfect.
give people a couple more minutes to join, and then we can go ahead and get started.
Yeah, that works for me. I'm grabbing one more photo here to share, so that's
Awesome.
perfect. I was gonna message the group. They're active in the thing right now and say, I'll answer your question. Just jump on the office hours. I actually should do that.
Yeah.
I'm going to do that now. Okay, very cool.
Awesome. Let's go ahead and kick this off. I'm gonna, I think, all right, we're already recording. Great. Just want to say welcome everybody to another installment of the Monthly Mastermind course here with our co-founder, Dr. Brian Harris. Format of these, Dr. Harris typically covers the bonding protocol, and most importantly, we're here to answer live questions informally. So you can raise your hand, you can type something in the chat, you can unmute yourself and ask a question. This is really our time for you, where we're here to help collaborate on cases, questions, and help make sure that everybody's an expert when it comes to working with Neer's products and making sure that you feel 100% comfortable. So, with that being said, I'm going to pass this over to Dr. Harris and take it away.
Awesome. Let me screen share here, guys. Okay, great. First off, welcome back. I love this time that we get to spend together. For those that are here, I want to make sure that you get the most value out of this time together as possible. It's one thing to ask questions in the WhatsApp group, but this is where we can actually like talk through some of these things. And the goal is that we come together and talk about successes, talk about failures, really just walk through the things that are important for you to know, so that the next time you sit down to do a case, you feel comfortable and confident with the process. Okay. So if you have specific questions, feel free to drop them in the chat. We'll answer those as we go throughout today. But I'm going to start off with sharing one case of mine that was going great until it didn't, at least in my perspective. And then I'm going to go through a handful of cases. I pulled some cases from the group chat thread just to talk about in more detail. There's been some great interactions there this last few weeks, and I wanted to go into some of those cases in more detail. Okay. So a patient came to see me in my office, younger, great teeth. I had done both her mom and her dad's smile, and both of them had nice, bright smiles. And the daughter now was having a smile that she didn't feel was super bright. And the thing is, the daughter herself is in the public eye quite a bit, and wanted a smile that just looked brighter and fuller. And so these are the tough cases in my practice, because I don't want to go and prep her teeth and put veneers on. She's got great teeth. It's not something she needs to do. But also, if I'm going to do something, I want to do it in a no prep fashion. But for younger patients, to regardless of the financial situation, to drop 25 grand for 10 porcelain veneers just isn't something that's as practical. And so we're seeing more and more patients, late teens, having the procedure done and having a smile that they love, that they can enjoy until they're ready to move forward with porcelain. So this is the before. We did it as a true no prep case, sent off, had the case sent back. This is with half of the smile tried in. So you can see really what we're able to accomplish is just a little bit of length and then a continuous color throughout, instead of the splotchiness that she was seeing from her own natural teeth. Because we also did it no prep, you can see on these canine, on the canine and premolars back here, where things start to maybe get a little bit longer, a little bit bulkier, which I'm fine with. I would much rather bond it in place and then come back and reshape after the fact to get it exactly where I want it. Um, and so this is kind of half tried in, and we got the other half tried in, and patients came in for approval and they were like, "Hey, we love it, but it's not bright enough. We want to go with something brighter." And at this point, this is BL1 HT and the Crown HT material. And I mean, it's essentially the brightest that I could order. And so the only option I have now is to go to a more of an opaque cement. And and so that's what we did in this case. And this is the final product. And I don't love it. And the thing is the patients are thrilled. She's super happy. Like they leave getting exactly what they want. But I share this for a couple reasons. I believe that at the end of the day, like you should always give patients what they want. It's the best way to guarantee to not have to redo a case is give somebody what they want instead of hurrying and rushing and putting something in and then finding out later that they're not happy and now having to redo it. The thing I don't love about it is if you look up close at the margins, when you're doing more of a no prep veneer, whether it's porcelain or it's a near product, it's almost impossible not to get some of that cement to show at the margin. And so I don't love seeing this white line right at the margin in some of these areas. Now, the tissue will heal down over some of that. Most of that will probably be hidden, but see how much more of an opaque look that opaque cement gives, where this would have blended nicely and perfectly and look great. And now we've got something that's much more opaque. And so when I say you should never use a opaque cement for these cases, I mean it. I really don't think you should. And the only exception is when it's truly something that is just what the patient wants, and they're not going to want anything less than that. So um, stay away from it if you can. I think it's kind of a unique circumstance where both of her patients or both of her parents have smiles done. Both of them are BL1 shade, and so you know it was kind of inevitable that she wanted to go brighter, but stay away from opaque cements if possible. Okay, questions on that? If not, I'm going to move. I'm going to move through some of the stuff, and then we can open it up to questions at the end. Um, Second case I wanted to share. Jonathan posted a case a couple weeks back, and I wanted to share this case because I thought it looked awesome. I think this is a great example of the right type of near case, choosing the right type of patient and ending up with a result that I think looks great. What I found is that patients that come to see me that are wanting to improve their smile, and typically they already have a fuller look to the lips, and they're wanting kind of more of width and fullness and brightness. They're looking for a certain look and style, and I think this is the type of style that we can give them with Neer. Now, are there little changes that we can make even after the case goes in? Yep, I think it's all going to be patient preference, but this is a good example of if the case went in and the patient said, "Hey, I think they feel a little unnatural or they're a little bit too big or too bulky," then the first step is, coming in and you can open up embrasures a little bit and just kind of perf perfect the more natural shape to things. On this lateral here, you could possibly soften the outside edge and open embrasures. But don't do those things unless it's what the patient wants. I found that most patients are kind of wanting more of a closed off embrasure look if you give them the choice. Now, I know some of you would prefer just to finish it and not let the patient have necessarily have much of a say. But this is a this is a good look. I think it's kind of a good combination of natural shapes and sizes combined with kind of a more of a perfected overall look and style to the teeth. So I thought this would deserved kind of a, a congratulations, great case. Um, okay. Let's say anything else about this case that I would share. What makes this a great case when you look at it, see how the embrasures where the teeth come together, like the facial embrasures, they're not super deep. This isn't a case where there's a lot of gum recession. There's not a lot of depth to the embrasures. It's a great case to be able to just bond the veneer right over the top and have a really nice result in the end. Um, this distal aspect of number 9, where it flares out a little bit into 10. Sometimes, if you don't come back and bring that in, that's what will cause the lateral to be flared out a little bit more, just because it's the only way to make it look size appropriate. But even after the veneers are done, you can come back and reshape things a little bit. But I think overall it's a great case. So nicely done. Um, okay, my thoughts from a treatment planning, diagnosis, like an overall strategy standpoint. I think this is a really, really difficult case to do with Neer. Now you can do it. You can send it off, have it designed. You can have it wrapped around the incisal edge and just hope that everything stays bonded in place. But the reality is, with these type of wear patterns, it's highly likely that you're going to get fractures. And so I want to encourage people that just because you can doesn't mean you should. And for those that have done a lot of smile cases before, what happens is they always, if they're done right, they always look good the day you bond them in or a week after you bond them in. But it's the 1, 2 months down the road when something does fail that it becomes stressful. So a no prep case can go from being no stress to really stressful very quickly once things start to fail. Because let's imagine we did 10 Neers in this case, and they were looking good for a while, and then one of them breaks. And so now you're kind of stuck. Do you get another Neer made in that case? And if so, how long is that going to last? And then another one breaks. And so then you're kind of stuck where you've got to go in and prep all of them off. And then, do you put them in temporaries? Now you got to prep the teeth. So
Yes, ma'am.
I would say that this would be a case that I would not do a Neer. And if it was a case that the patient wanted to do something more conservative from a cost standpoint, I almost think you're better off using like a low cost lab that will do the case in zirconia and do something more full coverage in zirconia with the right lab and just hope that they get it right and and not have to worry about things breaking over time. So in my practice, I would do full contour, probably Zircad Prime, so that you can still build in some natural aesthetics to the zirconia, and I would just build it up with a traditional crown and bridge, and and just let the patient know that you're gonna have to prep the teeth. So I think that's going to be best for them long term, and going to be a lot easier for you to manage. Um, so I would only do Neer here if it was more of a short-term solution to kind of buy them several months, but full coverage is going to be the best option. Um, okay, I saw this case in the group. This is the patient. Let me see if there was the after. No, different. So this is a patient that has a really deep bite. You can see kind of the wear on the internal of the upper incisors here. When there's a really deep bite like that, and there's a lot of wear, the risk of doing anything adding length is that that envelope of function is really really tight. And so there's a high likelihood that they're going to chip or break those anterior teeth. And so I would say that if you are going to do a case like this, I would absolutely make sure in the design that you have the veneer come all the way to the lingual aspect of the tooth here. And so just tell the lab just to take it all the way on the incisal ledge, all the way to the lingual, so that you can at least cover the entire incisal ledge. And it could be that now that area is going to be functioning in occlusion, but I would just rather cover that up and then kind of polish and adjust the bite in, as opposed to leaving ledges like this. It becomes harder for the seat, and it also becomes harder to maintain afterwards. So that's just my personal preference. Similar to where you see here, they took it all the way to the incisal lingual, carried over on the facials also. Okay. Great case. Somebody submitted asking if it was a good near case. And I think these types of cases work well from what I've seen in my practice. There's a couple little areas that I would say you need to be careful of. One of them is the canine, just how much it's flared out on the facial. That's gonna give an even more bulky look to the near. Also, number 8, already kind of long in the tooth, and in the smile line. So this is one in my practice. I would probably shorten 8 ever so slightly and then maybe polish the facial of 6 back with a burr just to make sure this one doesn't flare out too much. And other than that, I think it could be a great case. I mean, I think it just depends on the patient's cosmetic goals. This is also another area in through here you're gonna have to be really cautious of. This will be undercut here, and also on the laterals, kind of on these distal cervical facial aspect of the laterals are going to be areas that are going to be more undercut. So I just tell patients in these scenarios, hey, we don't have to prep away enamel, but we're going to get a much better result if you allow me to take a burr and just polish back a little bit on the distal facial line angle on the laterals, and then also a little bit on the canines. Otherwise, it's just you're going to see too much of a transition line there in that interproximal area. So it could be doable. I would do this as minimal prep if I was going to do a no prep case here. I'm sorry, if I was going to do a near case here, minimal prep. Not don't do it as purely no prep. I think it'll be too difficult to manage the aesthetics without it looking too bulky. Okay, another case from the group. I thought this deserved to be celebrated. I think it's a great case. I think something like this, not hard to do. This is kind of technically kind of undercut here, but you can see how it was managed nicely. I think to me, this is a great service for the patient. It will give them a smile they love, and we just see how many years we can get out of it, and I think it was good color choice overall, just great aesthetics overall. So I felt like that needed to be celebrated here. Another case, this is on the try-in. Um, I think this is like a really good outcome for Neer. Now, what I would do in this case, I think they tried it in with a more of an opaque cement. That's the only thing that I would say could be could potentially hurt the case is if that opaque cement shows up on the facial. So I would say, either that we do it out of a brighter shade and not use an opaque cement, or just be really careful using that opaque cement to make sure that there's a minimal amount at where that veneer meets the tissue line. Also, for my liking, I would open up these embrasures a little bit more, but I would do that after the fact. I would bond them in first, and then with a disc, I would open up those embrasures just a little bit more so that it's not too closed off here. But that's just personal preference and style. Patient may like it that way. So always ask them first before you go and make those types of changes. But I think overall, and this might be the final cementation. If it is, I think it's a great case. I would potentially open the embrasures a little bit more and maybe shorten seven a little bit and be good to go. There was talk in the group about white spot. I have seen it happen to one of my cases. And, I believe that it is because of, a little bit of air getting trapped in there, or I shouldn't say air, a lack of cement fully filling in that area is typically what it is. And so the best way to avoid that, and some of that has to do with the cement thickness that we use when we're designing the case. The thicker the cement layer, the easier it is to have things fit passively. If we make that cement layer much tighter, the gap there, then it's going to be harder for things to fit. So I would say make sure you fill enough cement inside the restoration. But let's say this was an air bubble and everything was seated. This is also the type of case where you could potentially just take and with a really fine diamond burr or carbide burr, just kind of make a little hole on the side. Instead of doing it right on the front, I would do it more kind of a side angle and see if it is kind of an opening there. Then you can always treat it, rinse it, put a little bit of bond in there, and then fill it with a flowable composite or resin cement and try to see if you can fill it in all the way. That I would say it's worth a try before you take the whole thing off. Try to fill it. Remember, it's resin based, and so you can very easily make a repair like that without it affecting the overall integrity of the veneer. Okay. So with that being said, I wanted to open it up to any questions. There was just a question in the WhatsApp group about polishing protocol. I'm going to oversimplify it a little bit. I think if you have the Ivoclar polishing kit that comes with kind of the cements for those that have gotten that kit, I would use just the protocol that it gives you with the always finishing with a rag wheel for the high shine. Now, I I prefer to get things back from Neer with a nice glaze on it and really not to have to mess with much of anything at all there. But let's say you did have to go back and polish something, and let's say it was one of the premolars that didn't get bonded down all the way, and so you took a burr to it, and now it's a little bit more rough, and you want to get it to blend better. Go through your normal polishing burrs, your composite polishing kit, whatever kit you have. The reason I say whatever kit you have is, there's usually like a more coarse and then a semi-fine and then fine. And then if you finish with the rag wheel, that should get it pretty shiny to where it should be at least close enough to the finish that comes back on Neer. Now, if you were, let's say you sat a case in Neer and you had an issue with glaze for whatever reason, and wanted to convert that more to like a nice hand polish, or let's say you sat it and the patient was feeling like things were too bulky and they wanted things to be more natural, then yes, you could essentially kind of convert it to a hand polish. And in that case, reshape things, thin things out where you need to, and then go back with the polishing protocol, and then finish it with the rag wheel and be good to go. So that would be, I know it's not the greatest advice when it comes to polishing. It's just what I found is, whatever resin polishing kit you have, use that, but always finish with the rag wheel. And for some of you, we've talked about it already. A Brasseler Brownie Point, like an amalgam polisher, in a high speed with lots of water and just very light pressure. It gives a nice shine to things too if you need to go down that path.
Going to open it up here to questions. If you have questions either about a case that you're currently thinking about doing, something's come up, you want to understand how to better position it, things like that, please don't hesitate to either drop it in the chat. Um, to be clear, we got one here from a doctor. To be clear, Neer can send it polished versus glazed, correct? I'm gonna give a brief correction to that. So we can send it unfinished. Now, unfinished is essentially we don't glaze the Neers after we've printed them, checked the fit, made any edits, things like that. That gives you kind of full control to do glaze yourself or however you want to finish those veneers. Kind of gives you a little bit more artistic freedom as well in the chair. Um, and then, kind of the standard way is to get them glazed from Neer. But both of those options are available in the portal, and you can also give that note to the design team as well. Are they polished at the lab? Um, in terms of like actually polished, like they should still be finished with the current material that we have. Like they should still be glazed. Um, we have. Do you want
It's
me to
gonna
pull up
come.
this photo, Dr. Harris?
Yeah, I'll pull it up.
Okay.
Yeah, it's gonna come if you ask for it unfinished, it will come unfinished. The reason we're not taking it through a full hand polish protocol at the lab is that we want to make sure that we don't overdo it in certain areas and we want to make sure we don't mess too much with contacts. The lab's really designed more for getting a nice glaze and finishing it that way. But we also understand that everyone has kind of their own protocol. I would say, I mean, I'm not asking for cases from the lab myself unfinished. The only time I'm following like a hand polish protocol is when I'm printing myself in office with the Midas, and it's more of a bigger, brighter, fuller, kind of where there's a lot of thickness. And we'll print it that way sometimes, kind of over engineered, and then polish it and shape it back with the patient until they love it, and then do a really nice hand polish on it. And it's just a kind of a different methodology and using it more as like a customized printed approach. But the biggest benefit of Neer is being able to just have it sent back, ready to go, bonded in, and be done with it. So hopefully that helps clarify.
Cool. Looks like Dr. Sharif has given a patient for us to take a look at. Do you want me to pull up that photo? Or do you got it,
Yeah.
Doctor?
Okay, I'm just looking at, okay, let's go full face first. Okay, so that's a full face. We'll get to the up close here too. Um, this is a great one to kind of compare and contrast with that last one where, I talked about not doesn't have super deep embrasures. It's more of a flatter look. Now this is the type of case where if you look at like number 7, see how it's kind of flat on the facial, but then interproximal, the embrasures get deeper. Those are the areas where you have to be aware that that can create an undercut, and either there could be a little bit of tooth structure exposed there, or when you go to seat it, it's not going to seat down all the way because it's slightly undercut. So anytime there's kind of this bell shape where the embrasure is deeper on the distal, that's something that we're going to want to look out for. Now, if you look at, sorry guys, Desktop is going to be a mess here. Go back to Zoom. Okay, here we go. Okay, so and this is good because it shows more. So you see where it could potentially be undercut on the mesial distal, and then where it thins out or where there's a little bit of wear on the cervical. So this is the reason this is important is you have to think about how the veneer would sit here deep into these areas and then also kind of out on the facial. So the best way to resolve something like this, if the patient's willing, is just a little bit of, take a disc, a little bit of polish on the distal line angles of the centrals and maybe on the laterals. That will allow things just to fit more passively. Alternatively, you just get it, you bond it in place, and it could be a little bit undercut there, or it could be a little bit thicker in these areas. But I think this is I think this is a good case. It seems like there's less occlusal issues, less like wear facets or flat areas. I think it could be a good case. Just be aware of those areas that are a little bit undercut. That would be my only concern in this case is undercuts. Let me look at the last image here. Yeah, I think it'd be a good case. Just know that, from that first photo, the teeth tend to look a little bit more bell-shaped or a little bit more flared out. And so I always the way I approach it with patients is, hey, we don't have to touch anything. We can take a scan, send it off. We can have these made. However, if you know this is something you're committing to and you want the best look, if we take a disc and just polish a little bit on the outside edges of those front teeth, that will give us a less flared look, and I think it will look better in the end. And just give them the option. I think as long as you're open about it, that's what's most important.
Okay, we got another question here. Was there any concern with the glaze having issues? And then this one might be a better question to dive a little deeper on. The goal is zero excess work. So how do you make, I'm just going to expand on that question on top of the glaze question, Dr. Harris. How do you make working with Neer as simple and kind of stress-free as possible?
Okay. I'm glad that the question was asked in that way. The easiest thing and the best thing is case selection, like choosing the right cases. If it's not an ideal case, do a little bit of enamel shaping first so that it can be more ideal. But really pay attention to the designs when they come back from the lab. That's the thing where I got burned on a couple of my cases purely because of my own error that I knew the patient wanted something longer and I didn't notice on the design that it was almost more the same length of her natural teeth. And so when we tried it in, it wasn't long enough for her. So just pay attention to the designs. And if you see something that you want to change, just ask for a revision and make sure the design looks the best that it can. So the best cases are when they come back from Neer and they've got a really nice glaze on it. So I don't have to worry about polishing or finishing or making a ton of adjustments. I've chosen the right type of case so they drop in nicely. There's no undercuts, there's no binding. And the design goes to that lingual aspect of the incisal ledge. So I've got a nice positive stop when I seat the case. Those are my favorite cases. I think when there are undercuts and now part of the tooth is exposed because you can't build into the undercut, or there's that one case we showed recently where the canines were flared out and we didn't adjust it beforehand, and so now the nears are flared out. It's basically everything on the front end that you can do to give yourself a better outcome on the back end. That's what takes all the stress away. Okay.
We got two good ones. Do you have a detailed video of how to polish Neers? And then part two of it is how do you get a patient to say yes? I can take the first one. So right now that we don't have a detailed video on how to polish Neers where we get like a nice close-up view. Um, I don't know, Dr. Harris, I'm in Arizona this week. Maybe you can just polish mine and we can record it. Show people how it's done.
Yeah. I
But
mean, once
we can.
if it comes from near and it's glazed, I mean, again, you shouldn't have to polish anything unless you have to make adjustments and then you have to go back and polish it. I would say the best detailed explanation is if it's a near case and it comes back glazed and it's finished nicely. The only thing that I would be using to polish would be a brownie point from Brassler with water and a high speed and just a little bit of pressure. I wouldn't bust out my resin polishing kit and try to go through that protocol. You're just going to take away some of that glaze and you're going to have a harder time polishing it back. Now, the question of is, has there been an issue with the glaze? There's been cases where we'll see the glaze wearing unevenly and it's been very sporadic. You know, it's not like an ongoing issue, but we have seen some cases. One got posted today where I'm like, I've never seen that before. And you can drive yourself crazy trying to figure out, like, I wonder what caused it. You know, it could be a number of things. But the answer for me is simply, okay, if it happens, you just have the choice. You're either going to remove the nears and start over, or go in and put a nice hand polish on everything. And if that's the case, then yeah, we'll get a video showing them how to hand polish so that if they had to salvage a case and polish off glaze for whatever reason, that they could hand polish nicely.
And then the second question, which is a favorite question of mine that we get to answer, is how do you get a patient to say yes? What's your process, Dr. Harris, when you have a patient in the chair or in a consult? How do you get them to say yes?
Yeah, I'm either doing my smile test drive that takes 45 minutes or an hour with flowable composite. I'm building it up right there so they can see it. Or I'm paying the $100. You know, I get the 5 packs of moments and I send out and have a moment made for them to try. And I always, when I put the moment in, I always still go in with discs and kind of shape and polish a little bit just to perfect things.
One interesting thing to add, just in conversations kind of around the moment try in of getting patients to say yes. One thing that I picked up from a doctor is when you're about to show the patient their smile for the first time, have them look at their smile through like a handheld mirror, or like take a video of them on their cell phone and give them that. Essentially, the goal is reduce them immediately going up as close as they can to look at any minor imperfections and things like that, and give them a chance to be wowed just by how big of a change it is. I know a lot of people use like, all right, we're going to shoot a little bit of Instagram content or something like that and then show them that. And then that can get a big reaction from that. And then once you're ready to take a look at the finer details, that's when you can make the edits to the moment.
Yes. Yeah, love that. And just know the moment. I always tell my patients, like, um, you know, look at it from standing back far away. If they get up close, because it's all one piece, it's going to look more individual. Now, if you've got one area, let's say it's between 8 and 9, and that area just looks really bulky, and you want to take a little mosquito diamond and go in and kind of reshape that. I mean, as long as even if you separate it into two pieces, as long as you can still get them in and get the right look, that's all that matters. But most of the time, you should be able to just drop it in, and from far away, it's going to look good and give them an idea of what's possible. And if it doesn't, you know, people stress out, well, what if they don't like it? Then, you know, it's use it as a communication tool and share with them, like, hey, one of the great things about the moment is it allows us to see what's possible. And sometimes because it is one piece, it can make things look a little bit bulky. And what I see here is like things definitely look bulkier, and the actual product is going to look more refined and more individual. So just call it out. If you don't love how it looks, don't say, "Oh, this looks terrible," but it's like, "Hey, we use this as a teaching tool to show us that when you are ready to move forward, what we want to change and what we're happy with."
Love that. Have a question here about removal. What's the best way to remove Neers without damaging the natural teeth if you need to replace it, want to upgrade it a couple of years down the line?
I mean, I'm finding with these, it's tricky with the laser. I haven't had to take a case off yet, myself, and so when I get to that point, I'll try with the laser different settings and see. But I mean, frankly, the it's like anything else. Once it's on there, the only way to get it off is to prep it off. And I always start, I'll do kind of more bulk reduction just with like a more coarse diamond burr and just kind of slowly start to polish it off and then go with like a red striped diamond burr and 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 just go slow until it's all off. Stop every once in a while, dry it off. You can usually tell the difference of where tooth structure is and where the Neer is, and then just make sure you polish everything up really good when you're done.
What's the longest you've seen a Neers case last?
I personally, from the cases that I've done, I think we're 6 months in, 7 months in. For my own cases, what's the longest case that we have out there right now, Patrick?
Yeah, I can give anecdotally, my Neers are 1 year old. They just had their birthday the other week. And then one of our co-founders' wives, uh, who got very early V1 Neers, I think about almost 5 years ago now. I think a little over 4.5 years ago. And she still has them on. But also being the wife of a co-founder, she has pretty good oral hygiene and takes good care of her teeth.
Awesome. Okay, I just realized I got double booked. I'm supposed to be on another webinar here 15 minutes ago, but I'm not going to jump off. I'm gonna stay on here. I'm already late, so they can have me be a little bit later. But I would say let's um any last questions, things like super important that you want to have answered tonight. Let's answer them now.
Yeah. Any last minute questions for Dr. Harris before he has to jump to another webinar?
I'll make a challenge. I'm sorry, guys. That's really tacky too to do that, Patrick. I'm sorry.
All
Uh,
good.
I'm just like, why does my phone keep blowing up? Um, a challenge to the group. Just find a case to start if you haven't started one already, um, and find the right types of cases. The right types of cases are the ones that I know it's not the ones that seem to be, coming our way are the ones that are like the most difficult to do. And the risk in doing a case like that is it's stressful. Things don't want to seat down all the way. Things are going to wear unevenly. I think the first few cases you should always do the most ideal cases possible so that you can get great results, have great example cases to share with other patients. Um, don't do it just because someone's looking for a cheaper alternative. Do it because they're looking for a cheaper alternative and they want it to look amazing. That's the best way to do it. Um, and then also let's continue to use the WhatsApp group and and make sure that before these office hours calls, if you have anything specific you want to dive into, Let's do it. Yeah, Jessica, let's do it. Show the photo. We'll do one last thing here and then I'll jump. I guess you can still stay on, Patrick, and answer questions.
Yep. All right, we got the photo up here of I think it's a potential patient.
Awesome. Um, would this be a good case? Just finished ortho. It's hard to see without the full face, but like I think this would be a good case for sure. The front teeth being a little bit oversized. So here's what I see when I look at the case and the front teeth being a little bit longer, specifically 9, and then I compare like 9 to 10 and where 11 is. Just this would be one where I would for sure go back further and um, do more teeth. If you try to just do the front four, I think it's going to look too bulky, but I think this could be a great case. I don't see any major concerns other than just the front teeth being a little bit oversized. But other than that, let's say that lip was down and they didn't have like a super high. If they have a really high smile line and show a lot of gums, and then you go and build something bigger and longer on top, then it's going to look a little bit too bulky, in my opinion. But if the lip line is lower, then then I think it could be great. And worst case scenario, you can always shorten 8 and 9 just a teeny bit before you scan.
Awesome.
He has a pretty high smile line, actually.
A bit more gummy smile.
Yeah.
It could still be a great case. I would just, in my practice, I always will just tell patients, say, hey, I want this to look great. I don't want it to look overpowering in the front. See how the front teeth are already a little bit big. Let's just shorten those a little bit, and then that'll give us a better result. And they should be okay with it.
The WhatsApp group is called the Clinical Lounge. I'm gonna drop that link actually in the chat right now. And then Dr. Harris, I do know that you need to go. What we can do once Dr. Harris drops, for those of you who don't know who I am Patrick, our head of marketing at Neer. We can move into some more practice related questions regarding marketing, whether it's social media, how to set up certain types of ad campaigns, what I'm seeing currently work out in the field for other providers. Happy to answer any questions in terms of how to set yourself up to compete with the best in the new digital world for the remaining couple of minutes here.
That'd be great. Okay, thanks, guys. Patrick, thank you.
Of
Appreciate you.
course. Awesome. So does anybody have any questions regarding what they're doing for marketing, how to get themselves out there for social media, what's currently working for a lot of doctors out there? I'm happy to help answer and guide through what I'm seeing and how you can easily get up there with some of the best. Awesome. So we have one here. I would love to hear how I can get myself on social media and on marketing advice. So I'm going to give a tip that I give to most dentists whenever I have this conversation. Probably one of the easiest things that you can do is Instagram is a wonderful tool. So is TikTok. What I tell most doctors to do is practice getting in front of the camera. And the easiest way to do that is most of us here get a lot of very common questions that we have repeated practiced answers for patient chairside conversations. So, how do I take care of my teeth after a gingivectomy? What is a gingivectomy? What is the best? What do you recommend for teeth whitening? Things like that. Things that have a good tie into what you're currently doing at your practice, and just post a question and literally take your phone, have it facing you, and just talk to it for 30 seconds. Doing content like that does one of two things. Instagrams and TikToks kind of algorithms are getting more content focused, So what they're looking for is watchable content that people can engage with. The other thing is it allows patients to see a bit of who you are. Now, I know I'm asking a lot when I'm saying get in front of the camera and talk. Not everybody is as comfortable with that, but I guarantee that starting to do those simple, frequently asked questions is a great way to boost your social reach. Now, the other thing to do is to do local hashtags. So, what that means is I'm currently based in San Diego. So, let's say I'm posting content and I want to target, San Diego veneers, right? My hashtag would literally be hashtag San Diego veneers to start to target patients in those areas that are searching for that type of content. Um, Last thing that I'll say is when we, post content about our veneer cases, don't just tag Neer, invite us to be a collaborator on your post. That way we can help boost that content on your behalf and help you reach a larger audience. So whenever you invite us to be a collaborator, just so that we're aware of what I'm able to do, then is I'm actually able to spend money to boost that reach of that post. If we're just tagged, I don't get that option. So when we're a collaborator on that post, we can help boost your social reach. Hopefully that answered that question. I know I went on a rant. I get excited about this stuff. Yeah, I can post a link for the WhatsApp again. We have a question here. I tried to upload my case, but can't break down the byte from the STL via the iTero export. And how do I get them in OBJ format? So, what I can do for you is I can have somebody follow up with you after this call and walk you through just how to export a color scan from um, an iTero scanner. But if it's the scan is in occlusion, this is a helpful tip and trick for everyone here. I think most iTero scans are like in occlusion like that. Just upload the same scan to the byte scan portion. So just upload upper arch, lower arch, whatever into the byte scan option because that data is already there. We have another question. Can we collaborate on every video or just specific ones? I will collaborate with you on every near and moment video that you do. So as many as you want to do, I'm here to collaborate. And then if you also reach out to your near rep, they can help book a time with me and we can, spend 30 minutes out of the day and just talk through what some of those strategies might be if you want to get a bit more involved with how to collaborate on Instagram. Yeah. You know what? We'll just let me pull up my Calendly link and I'm just going to drop that in the chat for those. Give me 1 second. On average, what are people currently charging? That's another great question. So what I typically hear people do is half of what their porcelain case. I think our national average is somewhere around 7,000 to 7,500. Um, and just so that we're aware, the link that I'm dropping in here is a marketing meeting with me. If you want to set up some time on my calendar to better collaborate on some marketing efforts, we can kind of walk through that. But yeah, I think the national average is around 7,000 to 7,500. A lot of doctors are finding success with that. Um, However, we do ask everybody to respect the floor price, which is $5,000. Any other questions? We're going to leave it open for a little bit. 5,000 for upper and lower. So this is actually a good question because it's a good clarifying point. Neer only does the upper arch. We do 4 through 13. The lab fee for 4 through 13 is $1,000. It is $250 to add a backup set to that order. The reason why we don't do the lower arch is a lot more complications come into play when doing Prepless on the lower arch. It lowers the patient pool by quite a bit, or the requirement for, more invasive prep is needed in order to make that functional bite work. So it's only for the upper arch, but yes, $5,000 for the upper arch. Any other questions related to, product questions? I can answer those all day. Or just general positioning questions, marketing questions, things like that. I am happy to help. If not, we'll wrap up here. But one thing that I did want to leave everybody with, some trends that I'm starting to see from other dentists is doing a free virtual smile consultation and having this be the start of your new patient funnel from your social media advertising, from Google advertising, whatever type of advertising that you're doing, even if it's like print mail stuff that you're sending out to patients in your area, but being able to have some sort of way to do virtual smile consultations, essentially setting up a landing page or a form where you get some of the basic information from your patient, what they're looking to accomplish with their smile, things like that. But more importantly, you get photos of the patient's face, their smile, close up of their teeth, those types of things. And then you schedule essentially a 15-minute consult with them. You can block off an hour, a couple hours a week to handle some of these virtual consults.
It's still playing?
I know a lot of doctors find that very easy to bring in new patients as well as qualify them without wasting a bunch of time. So that's something to look into. If you have, again, further questions, you can reach me at patrick@getneer.com, or you can book some time on that Calendly link that was dropped in the chat. But with all that being said, if there are no other questions, we'll close it out here. As always, give me a couple hours. We'll get this recording up on YouTube and back out to you. All right. Thanks so much, everybody. I hope everyone has a great night, a great rest of your week, and excited to see some of those smiles that you're giving your patients and seeing that in the clinical lounge. Have a good night.